Hello, everyone. Welcome. My name is Debbie Kornman, and I am the Associate Director of InCHIP. I want to welcome you to the InCHIP lecture series for the final presentation this semester. Before I introduce our speaker, I want to let you know that there's going to be a Q&A session following the presentation in the last 15 minutes or so of the hour. So please hold your questions until then or enter them in the chat during the talk. Nana Marfo will be moderating the Q&A session, and there she is, and you will be muted until that Q&A session. In recognition of Sexual Assault Awareness Month, we're thrilled to have Dr. Kristen Jozkowski here to present on her really important research. Dr. Jozkowski is the William L. Yarber Endowed Professor of Sexual Health in the Department of Applied Health Science at Indiana University. And she's also a senior research scientist at the Kinsey Institute for Research in Sex, Gender, and Reproduction, also at Indiana University. She got her bachelor's degree in biobehavioral health from Penn State University and her Ph.D. in health behavior from Indiana University. Her research has centered on the prevention of sexual violence, and she has a particular focus on sexual consent and refusal communication among college students. In her work, she's examined alcohol-facilitated sexual assault risk factors and socio-cultural factors that influence sexual violence and consent communication, and that includes gender norms and sexual double standards among college students. She is one of the leading researchers on sexual consent. She's highly committed to reducing rates of sexual assault on college campuses through her research and advocacy. She's authored over 90 peer-reviewed articles and over 200 presentations at national and international conferences. We're so happy she's here. Please join me in welcoming Dr. Jozkowski, who will present on the need for affirmative sexuality in the era of affirmative consent.
So thank you so much for that introduction. And good afternoon, everyone. Thanks for coming to the session here, to the last lecture of the series, and on a end of the semester. I understand, there's a lot of things going on when you get to this time of the semester, so I really appreciate people being here. Like Debbie said, my name is Kristen Jozkowski, and I'm at Indiana University. And I just want to really, before I get started, thank Debbie and Melanie Skolnick and Amy Gorin, Lynn Hendrickson, and Josh Harden for inviting me to be part of the lecture series and also coordinating all the logistics. And then also thank Nana for moderating the discussion today. I'm really delighted to be speaking with all of you today. And like Debbie said, I'm going to talk about affirmative consent, which some of you may be familiar with. I think that we've heard more about the terms affirmative consent just in mainstream discourse. Media's been using that term a lot. So I think it's hopefully relevant to folks, especially that we're all on college campuses. Some folks attending maybe college students or people who work with college students. I think it's a really relevant topic to talk about, and especially given this month being Sexual Violence Awareness Month. So today specifically, I'm going to talk about the need for affirmative sexuality in the era of affirmative consent, as I think it's really important. And I think the importance of and the need for affirmative sexuality has been sort of missing in discussions about affirmative consent. And so I'm going to talk a little bit about what that means and why I think that is. So in this talk, just to give you a kind of, look ahead of what's coming, I'm going to discuss affirmative consent. I'll provide a brief overview of some current consent research and demonstrate how and why I think we need affirmative sexuality for affirmative consent to be effective. And then I'm going to conclude with just some recommendations. I'm a public health researcher. I can't sort of end a discussion without saying, okay, here's some application for public health or for intervention. And then along the way, I've tried to be really careful about inserting the articles or the references that I'm citing, so that way people are aware of the work that I'm citing. So if you want more information about any particular aspect of this talk or want to see any of the papers, I'm happy to send this to you after the talk. You can shoot me an email. So let's go ahead and get started then. So to begin, one of the reasons we've heard about affirmative consent is because it's in response to the high rates of sexual assault on college campuses, particularly high rates experienced by college women. So, a common question, or I think a question that begs answering, is how common is sexual assault? And if you look at different research reports, findings suggest that maybe 1 in 4, 1 in 5 women will experience sexual assault while they're on college campus. But some have called this statistic controversial. Other people have said that it's a misleading statistic, or that it's not even close to 1 in 5. So what's going on here? Why do we have this sort of critique or this concern being brought up about rates of sexual assault? Well, some colleagues and I conducted a large-scale review of research, and we published this article in which we evaluated the 1 in 5 statistic. And we concluded that there is empirical support for the statistic and that it's reasonably accurate. 1 in 5 is reasonably accurate. The difference in rates that some have called attention to really come from different study methods and what sort of quote unquote counts as sexual assault. So ultimately, we concluded that this controversy that may exist is really about values and how people define sexual assault. And that relates directly back to consent. So I just want you to keep this in mind because I want to come back to this point at the end of the discussion today. But first, let's take a step back and define affirmative consent. So affirmative consent can broadly be defined as actively communicating agreement to engage in sexual activity. That's void of coercion. And so because affirmative consent has to be active communication, that means that lack of protest, lack of resistance, lack of refusal, and silence all wouldn't qualify as affirmative consent. So again, just kind of the underscoring that it's an affirmative or active agreement to engage in sexual behavior. And in 2014, California was the first state to pass state-level legislation requiring institutions of higher education to adopt affirmative consent policies. And then in 2015, New York passed similar legislation. They followed suit. Since then, a few other states, including Connecticut, have passed legislation requiring the inclusion of affirmative consent policies or standards at institutions of higher education in their state. But even among universities that are in states that don't have legislative requirements, at the institutional level, many have put forward affirmative consent standards. So they've put forward these standards that are in place. And so to give you an example of what I mean by that, in Indiana, where I'm at, Indiana University, our student code of conduct defines consent in a way that would be consistent with affirmative consent. So although the state of Indiana doesn't have a state-level legislative mandate, the university, Indiana University, does have a definition that's consistent with affirmative consent. And in fact, over 1,500 universities are like Indiana University in the United States. They've implemented these standards disregarding whether there's a legislative mandate. So affirmative consent's clearly becoming something that's being more adopted, whether it's overtly like California and New York and other states that have legislatively required it, or even subtly where universities are adopting it without making the state requiring them to do so. And when California passed this legislation, there were some critiques, such as the notion that affirmative consent would ruin the moment. That was something that was really talked about and I think depicted here in the cartoon I have up there. Another critique was that affirmative consent is inconsistent with how people currently communicate consent. And I found this to be sort of an interesting critique because if people were already engaging in affirmative consent as a common practice, you wouldn't really need a policy or a mandate or legislation to change people's behavior because people would already be doing it. So I find that critique just sort of interesting. And then importantly for today's discussion, another critique is that affirmative consent may not address or won't address sexual violence. So I'd like to focus on this critique today because I too have been critical of affirmative consent policies, particularly when they're the only mechanism implemented to address sexual violence. And this has to do with the ways in which I think gender norms influence aspects of affirmative consent that really limit people's ability to consent. And I'm going to talk very specifically about what I mean by that. But let's first unpack affirmative consent a little. Affirmative consent is a consent promotion-based initiative. And like any other consent promotion-based initiative, the emphasis is on clear, explicit, active communication to reduce sexual violence. And that stems from the miscommunication theory or the miscommunication hypothesis. And this theory states that some men don't really understand that they need to obtain consent, or they don't understand what obtaining consent looks like. And this theory also suggests that women don't adequately communicate consent clearly. So together, these factors together sort of create an opportunity for misunderstanding or miscommunication that then leads to sexual assault. So the idea behind consent promotion-based initiatives is that if we promote clear and active communication of consent, you'd alleviate sexual assault because you would dissolve that misunderstanding or miscommunication. And there is research to support this theory, specifically some laboratory-based research that suggests men overinterpret women's sexual interest. And this is done in sort of two different ways. You might have in laboratory settings, women and men observing interactions, and the men tend to observe the women's, what they're observing from the women, that those behaviors or those actions are more implying more sexual intent than women would be, than the women who are observing would apply to women. And then also when people are engaged in discussion, that men believe women are being more sexual in nature than women think that they're being or women intend to be. But those are in laboratory-based studies. Then also some other research that suggests that women's refusals are token, or the term I have on the slide is token resistance. And what that means is that token resistance sort of means that women don't actually mean no when they say no. Their refusals are not legitimate, and that they're saying no, but they mean yes. And some people endorse, or some men endorse this notion that women engage in token resistance. However, there's a lot of research that refutes the miscommunication theory. And specifically, this research suggests that women do communicate consent clearly, and men accurately interpret women's refusals, even refusals that might be subtle and don't include the word no. Men still have a very refined ability to understand those as refusals. And other research that actually suggests that women rarely engage in token resistance. And more often than not, when women say no, they mean no. So this sort of research says, miscommunication is not really at the heart of sexual violence or sexual assault. And I also just want to take a moment here to note that the miscommunication theory sort of reinforces heteronormativity by addressing sexual communication between women and men. So to that end, the information, the data that I'm going to be drawing on and presenting today is really specific to heterosexual sex. And of course, we know that there's diversity in sexual expression. But most of the research, the consent research, including a lot of my own, has really focused on heterosexual, consent and heterosexual sex, whether that's by circumstance, because that's who ends up being in samples, or it being intentional. But I am pleased to say that there has been a growing body of research that's been examining consent beyond heterosexual contexts. And my more recent work, I've also been looking at consent outside of heterosexual contexts. But I'm not going to be talking about any of that research today. So let's define consent here. In a review article I did with some colleagues, we define consent in 3 ways: as an internal state of willingness, as an act that's explicitly agreeing to something, and then as a behavior that someone else might interpret as willingness. Now, this second conceptualization of consent is really where most of consent research to date has focused on, this idea of what cues you're communicating to indicate consent. And in fact, I'd argue that affirmative consent really draws on this conceptualization, as well as a little bit on the third one as well. This, notion of what people are doing to communicate consent, and then what people are interpreting as consent. But, regardless of which conceptualization, affirmative consent really does require, again, that consent communication be explicit, whether it's verbal or behavioral. And importantly, that it be active, that you're doing something. So drawing on these latter 2 conceptualizations of consent, let's look at how people communicate consent. People report using cues that are explicit and verbal, like what you might see here. They also report cues that are explicit and nonverbal, like here. Cues that are verbal and implicit, and then cues that are both nonverbal and implicit. And then we see people reporting cues such as not resisting or not saying no, which I mentioned earlier, is inconsistent with affirmative consent. And these types of cues are certainly even more implicit and nonverbal. But also, they're the way in which people report cues can occur in myriad ways across these axes. So there's a lot of different ways that people communicate consent. I'd say that gold standard is going to be that explicit verbal. But again, affirmative consent would really be anything that's active. But it's also worth noting that context may influence consent communication. And so what do I mean by context? For example, gender. Women are more likely to use nonverbal cues to communicate consent, whereas men are more likely to report using verbal cues. And then another important context to consider is the sexual behavior that people are reporting consenting to. So people are more likely to report using explicit or more explicit forms of communication of consent for intercourse behaviors. And then compared with other behaviors like kissing or touching, people report using more implicit or nonverbal cues, or even something that we call no response signals, which is kind of that not resisting, not saying no, just kind of proceeding with sexual behavior and seeing if someone refuses. And then oral sex kind of falls in the middle there in terms of how explicit those cues are. And then a third important context is sexual precedence. So sexual precedence refers to people with a previous sexual history. So there's a precedence of sexual behavior. And that generally refers to people engaging in sexual intercourse. When you look at research on sexual precedence theory, they're really referring to sexual intercourse. But essentially, with regard to consent, when there's sexual precedence, people are more likely to rely on that lack of resistance or not saying no. And another way that this has been described or can be thought about is tacit knowledge. So this idea that you just know or you're just assuming that the other person's consenting without them actually communicating it. And tacit knowledge clearly contradicts affirmative consent, as I mentioned earlier, as it doesn't include any sorts of active consent communication, but rather relies on assumptions. So in addition to gender, sexual behavior, and sexual relationship context, another important context related to consent is the location in which people start interpreting someone else's consent. And this concept kind of came to me. I was reading some different various studies about consent, and in these preliminary qualitative research sort of suggested that young adults perceive the transition from a public to a private setting as indicating consent. So I pulled these two quotes that are up on the screen from two studies that were about consent and refusing. And the authors kind of note this really kind of small or subtle finding that notes that this transition, that people in their sample were sort of perceiving this transition from a public to a private setting as indicating consent. But it wasn't really the focus of the study, nor did the researchers spend a lot of time going into it because they were talking about other things in the study. But these sort of like nuggets of information led me to sort of question, at what point could someone realistically consider evaluating another person's actions to determine consent? What point in a social interaction do people start doing this? And so I conducted a series of studies to investigate sort of this notion of whether people perceive consent communication, this like process of consent, as beginning in a social context, like a bar or a party, specifically college students. So I'm going to present data from some of these studies, and two of these papers are based on interview data. And so when I'm presenting the information or presenting quotes from the studies, just know I'm using pseudonyms for participant names. So the main question I was interested in was for these studies was, do people perceive this process of consent as beginning in a social context like a bar or party? And does the transition to a private context like a bedroom, a home, apartment, etc., is that part of this consent communication process? Well, as exemplified in this quote, the main finding is that that college students were perceiving consent communication starting in a social setting. Specifically, researchers, including myself, really tended to focus on consent cues that might occur immediately preceding when sexual behavior may or may not occur. And, you can kind of think about this as the proverbial bedroom. But young adults or college students were really looking at cues that were in the social context, like a bar or a party. And you can see that exemplified in this quote from Sandra. And then in particular, that transition was an important indicator of consent as noted by college students. However, I noted earlier in the talk, and I talk about in these papers, that factors such as gender norms and socially constructed gender roles influence consent communication. And in particular, gender may influence consent in the context of, or when alcohol is being consumed, or when people are intoxicated. And we know that college students tend to conflate, engage in drinking and then engage in sexual behavior. So I really thought it was important to look at these two, factors with regard to consent communication. So I want to present some information about how gender first might influence consent communication, particularly these outside the bedroom consent cues that I was interested in those studies. So what we found was that there was a distinction in terms of how women and men were interpreting these cues. As you can see in this quote from Nick, men were more inclined to perceive the transition as an absolute indicator. He says, if she leaves the bar with me, it's like game on, we're going to have sex. Whereas women were more tentative in their articulation of cues in the social setting, and the transition home is definitely indicating consent. And you can see here, again, the same quote that I had in the previous slide from Sandra. She says, the being in the bar was the first attempt to let her partner know that sex was on the table, that she was willing, but the final decision didn't come until they were in the bedroom. And that's, putting the condom on was that sort of indicator of consent. So women, indicated, and these cues are just sort of indicative of what I was seeing across the sample, in that women were indicating cues in the social setting and the transition as potential indicators of consent, but could also indicate romantic interest or other sorts of, things, whereas men were much more absolute in their articulation of these different cues as indicating consent. So now throwing in alcohol consumption, in the same study, we also found that consuming alcohol in a social context was perceived by some as an indicator of consent. So how did gender norms function in this context? Well, again, that disjunctive interpretation by gender emerged, in that we saw that men were more explicit and absolute in their articulation, that these cues automatically equated to consent. And you can see that depicted by the quotes from Russ and Mike, where they talk about women drinking or partying as being indicators, letting men know that they're interested or willing to engage in sexual behavior. And again, alternatively, women were more tentative, suggesting that these cues associated with alcohol could indicate consent or could indicate romantic interest or just interest in having a good time. And again, this is sort of exemplified by the quotes from Jessica and Sarah, where they talk about, drinking could mean a lot of different things. Like could mean interest, particularly accepting a drink could mean interest. It could be romantic interest, sexual interest, or it could just mean getting free drinks and having a good time. So I think part of this disjunctive interpretation emerges because you have potential constraints on women's sexuality. So it could be that women telling me, the interviewer, that about consent, that they felt like they couldn't be as absolute. So that is something to consider, that just by what they were articulating to me as the interviewer, they may have felt like they had to be more reserved, or they may feel like they have to be more tentative in their articulation, whereas men were just more, absolute because that's what they actually, believe or think. But regardless, this information suggests that, this information in particular to alcohol consumption cues, it suggests that college students were perceiving alcohol, and in particular buying and accepting drinks, as potential indicators of consent communication. And I think it's important to highlight this disjunctive sort of interpretation, because women and men were both acknowledging these cues related to alcohol as being associated with consent, but they're not quite interpreting them in the exact same way. And I think that's, an important distinction to note. But more generally, I also think it's concerning that college students were conflating alcohol consumption and the exchange of drinks with consent cues, especially given that we know alcohol consumption can impair cognitive functioning. So I want to take a kind of like sidebar for a moment and talk about alcohol in a little bit more detail. So to explicitly examine how alcohol intoxication might influence consent, we conducted this study to assess people's perceptions of their ability to consent to sex while intoxicated. And I have to say, this study was conducted in bars, and I'll talk about the findings over the next couple slides. But one of the things that I wondered after I conducted the study was whether bars, as being a more sexualized environment, people were just more inclined to think that they could consent because they're in a context where sex is sort of seen as something that you do. When you go to the bar, you're in a sexual environment. So I replicated this study recently at tailgate, so another drinking context, but not in a bar context. And the findings were very, very similar. I shouldn't say exactly the same, but they were very, very similar. So that paper's not yet out, but just to give you a sense that while this study was conducted in bars, we found very similar results in non-sexualized drinking contexts. So in this study, we looked at we assessed people's perceptions of their ability to consent to sex while intoxicated. And then we also tapped into that third conceptualization of consent that I mentioned earlier, that, the interpretation of behaviors as willingness to engage in sexual behavior. And we did that by assessing how alcohol intoxication might influence people's perceptions of their friend's ability to consent to sex as well, while both the participant and the friend were intoxicated. So to do this, we recruited people in dyads of friends at bars while they were drinking. And then we separated the dyad and interviewed each individual of the dyad separately. And we asked them about themselves, and we asked them about the person, their counterpart in the dyad. And we asked each person about their own ability to consent to sex, to have sex without blacking out or passing out, if they would remember having sex the next day, and if they thought they could have sex right now. And then we also, like I said, asked the same questions pertaining to people's perceptions of their friends, and that's exemplified by the words in the brackets. And then we randomized which order people, we randomly assigned which order people got the questions in, whether they were asked about themselves first, or their friends first. And then we also assessed breath alcohol concentration and some other alcohol-related variables that I'll talk about on the next slide. So first, with regard to some of the alcohol consumption, we found that our sample was pretty intoxicated. They reported having consumed about 5 drinks and had a BRAC, a breath alcohol concentration, of about 0.08, which is the legal limit for driving a vehicle. We also found that people reported about 1 alcohol intoxication symptom for themselves and their friend. And then about 10 to 20% of the sample reported various symptomologies related to alcohol. And this could be loss of critical judgment, impaired balance, slurred speech, disorientation, and drowsiness. So next, in terms of participants' perceptions of themselves in terms of consent, we found that participants thought that they could consent to sex, have sex without blacking out or passing out, and would remember having sex the next day. So, upwards of 90% of the sample felt confident or perceived that they could do all of these things. And it's important to note that the people who were making these claims were saying these things, they were, fairly intoxicated. I just talked about on the previous slide that people had reported consuming on average about 5 drinks. And it's also worth noting that there was variability in intoxication level. There were some people in the study who were pretty intoxicated, and there were people who were less intoxicated. And yet there was really very little variability in terms of people's perceptions of their ability to consent. So next, we looked at whether these alcohol intoxication variables predicted the consent beliefs or consent perceptions. And the variables that we included as predictors were the number of drinks people had consumed, how intoxicated they felt, the number of alcohol-related symptoms that I just showed you on the previous slide, and then the total number, and then their breath alcohol content. And we found that actually none of the variables predicted one's ability to consent to sex. But we did find that the total number of symptoms people reported predicted whether they thought they could consent to sex without blacking out or passing out, as well as whether they would remember having sex the next day. This was, again, people's perceptions about themselves. We also asked people's perceptions of their friends' ability to consent to sex. And again, we found overwhelmingly people thought their friends could consent to sex, would have sex without blacking out or passing out, and thought that their friend would remember having sex the next day. So we also asked again whether the intoxication variables would predict the consent beliefs as applied to their friends. And we found that none were associated with people's perceptions of their friends' ability to consent to sex or have sex without blacking out or passing out. But we did find that total number of symptoms predicted whether people thought their friend would remember having sex the next day. And also, as I think maybe you've gathered already, but I'm really interested in gender norms and how they influence consent in various ways. So with regard to the people's perceptions about their friends, we were also able to consider gender norms, or we did consider gender norms, I should say, because we collected data from dyads. We could examine the gender pairing of the dyad as an additional predictor of the different consent belief variables that I showed you pertaining to participants' perceptions of their friends. We found that it was only a significant predictor for whether participants would allow their friend to have sex right now. So for that one, outcome variable. And specifically, we found that 91% of those in man-man pairs, so the dyad comprised two men, they would allow their friend to have sex with someone. That's what they reported in the interview. Compared with 58% of those in woman-man pairs, and then only 33% of those in woman-woman pairs. So what can we take away from these findings? I think we can conclude that alcohol intoxication doesn't really seem to influence people's perceptions of their own or their friends' ability to consent to sex. But when we think about people's willingness to let their friend have sex, gender did matter. Disregarding BRAC or symptoms, men seemed relatively okay with their friend going to have sex with someone, and women were less okay with it, right? There was a big discrepancy in those percentages. And I think there's a few reasons why this might be the case. First, women do report being more tentative in their interpretations of consent in relation to the social setting and alcohol consumption, thinking back to that data that I showed you earlier. And additionally, it may be that bystander interventions, which are another common sexual assault, sexual violence intervention on college campuses, and I don't really go into bystander interventions. I'm not really talking about them today. But in brief, these interventions focus on pro-social third-party interference as a mechanism to address sexual assault. So in other words, people observing risky behavior and then intervening or stepping in prior to a sexual assault occurring. And so it may be the case that messages about bystander interventions really resonate more with women, and therefore they're less likely to think their friend could, leave with they would let their friend leave with someone to have sex. And that's not entirely surprising, given that women are more likely to experience sexual assault victimization than men. And then finally, we may have also seen this gender distinction emerge because it could be related to this sort of myth that people perceive men as always consenting. They're always wanting sex and always willing to have sex, so their consent is somewhat irrelevant. And supporting this claim, in another study, we found that there is sort of this social expectation that men just always want to have sex, and therefore their consent is irrelevant because they always want to engage in sex. We found that both women and men seem to endorse this myth. So as a result, people may not perceive it necessary for men to consent because it's assumed that they just do. And therefore, that may explain why those in man-man pairs were more likely to just let their friend go have sex, because there was no need to really worry about the friend. They were going to consent. They were going to be okay with it, disregarding how much alcohol they had consumed. So I want to come back to that interview data that I was talking about earlier, and come back to some of those gender norms. So another example of how gender norms, I think, influence consent emerge in terms of social expectations about who consents and how people should consent. So, for example, men in that study talked in ways that sort of implied a social repercussion for women who may consent too readily or too affirmatively. For example, Damien says that women having too much sex is problematic because, as Joe says, women who have not had as much sex are higher or nicer. The reason being, according to Richard, is that it's not socially acceptable for women to have multiple partners in the same way that it is for men. And in fact, women who have multiple partners might be labeled negatively, as you can see here, how he provides some labels that are certainly disparaging. And this may influence how women and men engage in and perceive consent. According to Eric, for example, men will initiate sex and women have to decline it, at least initially, to appear as though they have standards, quote unquote standards, which is similar to that notion of token resistance that I talked about earlier, that women don't really mean no when they say no. They have to say no at first to appear like they have these standards, so they're not too easy. And then they can, they can consent because they really want to consent and want to say yes, but they have to at least put up this front. But we know that women actually don't really engage in token resistance. That's not as common as some people might think it is. And it's also important to note that women were aware of these social repercussions, preventing them from sort of saying yes affirmatively. For example, in this passage, Sandra talks about how she's a friend who gets drunk, so they have an excuse to have sex. So in other words, they blame engaging in sex on being drunk. And I think the subtext here is that women shouldn't want sex and shouldn't engage in sex, so they need an excuse to engage in that behavior. And when I pushed her to better understand who requires excuses, she indicated it's women. Because according to Sandra, if women don't have an excuse and just want to engage in sexual behavior, they're just kind of being trampy. And then in addition, women are also not supposed to initiate sex. According to Laura, women are supposed to wait and let men initiate. Because again, if women initiate, there are social repercussions. I think Laura's sentiments are similar to what I showed you from Eric earlier, that women can't be too forward in their sexuality or sexual desires, because if they do so, they're just kind of being slutty, like she says here. And this notion that Laura and Eric sort of allude to, that men initiate sex and women serve as the gatekeepers. By gatekeeper, I mean women are the ones who either consent, agree to or refuse sex. This is reflected in what we call the traditional sexual script, that men initiate and women gatekeep. And college students, still seem to endorse these scripts that Laura and Eric talked about. In that same study that I showed you from earlier about the notion that men are just assume their consent is irrelevant because it's assumed they always want to have sex, we also found that college students talked about consent in ways that really reinforce the traditional sexual script, that men initiate and that women gatekeep. This really limits how people can communicate consent, and in particular constrains women's ability to seek consent. However, in addition to sort of having these social, in addition to not really having social permission to say yes, to say yes or to consent to sex in an affirmative manner, women also kind of face challenges declining sex as well. For example, women reported feeling bad that they perhaps owed men something, particularly if they bought men drinks. And this is interesting because we talked about that, association with exchange of alcohol as an indicator of consent. Or it could apply if men allowed women to spend the night somewhere, like if they were too intoxicated to go home. Because according to Jennifer here, women reported feeling pressure to have sex, again, especially if they spent the night somewhere or someone bought drinks for them. It was a way to reciprocate being allowed to stay, which is similar, you can see that sentiment reflected by Jessica as well. The notion here being that women owe men something that they need to reciprocate through sex. And then another facet of women not really being able to say no comes in the form of men ignoring women's refusals. For example, Richard says that if women's refusals are soft, and by this he meant not overt expressions like screaming, no, or leaving, he'll continue to pursue sex post-refusal. However, Mike says that women should give clear signals, but they shouldn't be so clear that it's blunt or awkward. And this is sort of a tricky line to navigate, particularly given what Richard says, that he's going to ignore more subtle refusals. And similarly, some men talked about being able to convince women to change their minds if women said no. As Eric argues, he believes women can be convinced, which may stem from his belief that women engage in token resistance and have to, at least initially, refuse to appear like they have those standards. That same sentiment is reflected here, where he mentions that women may say no to put up some friction. And then similarly, Damien mentions that if a woman doesn't seem sure or perhaps is providing those subtle forms of refusals, he believes she can be convinced. And this is concerning given some more recent work that I've done where we've examined the cues people use to refuse sexual behavior. Those findings really suggest that college students use nonverbal and subtle cues to indicate that they're declining sexual behavior. And we also found that college students report using nonverbal and subtle cues to interpret refusals. So, this sort of idea of requiring an overt refusal, or as one research team in New Zealand put it, an obvious gesture, that doesn't really seem necessary for people, particularly men, to understand that someone's declining their sexual advance. And having one's refusals ignored is obviously concerning. In this study, we found that college students experienced non-consensual sex because they realized refusing was useless. So they realized that if they refused, it was going to be ignored. And rates were decently high for vaginal penile sex, and even higher for sexual behaviors other than vaginal penile sex among both women and men. And it may be the case that women's refusals are being ignored because men believe that women can be convinced to change their mind. And men's refusals may be ignored because women might not perceive them as genuine, supporting that myth that I mentioned earlier. The bottom line here is it is concerning that we see that people believe that they're experiencing non-consensual sex because they believe refusing is useless. So there's some other examples of how gender norms may influence consent that include women rationalizing uncomfortable or unwanted sex as part of just being in a relationship, and that sometimes men don't provide women the opportunity to refuse. In this study, we found that men sort of thought that women may say no, so rather than ask for consent, they just sort of proceeded with sexual behavior and sort of rationalized that they would ask for forgiveness rather than ask for permission. So collectively, I think these findings really suggest that gender dynamics infringe on affirmative consent communication and really set up some barriers to affirmative consent. But despite these challenges, consent-affirming messages, I don't think that they should be disregarded altogether. In fact, sort of the collectivist notion that consent and sex occur between people that underlies affirmative consent, I think that's really important to promote. And in fact, I'd argue that messages that consent is sexy, which is part of the affirmative consent dialogue, promotes affirmative sexuality and sex positivity. And that, to me, seems promising. That consent being sexy doesn't really emphasize traditional gender norms that men initiate, women respond, and those sort of norms really have perpetually underlined consent communication, that men need to seek consent. That's been part of initiatives prior to affirmative consent. And I think affirmative consent, and particularly consent being sexy, sort of opens up that dialogue in ways that I think is helpful. And also, affirmative consent, promoting consent as something positive, good, and sexy, can also be helpful for a number of reasons. First, in a few different studies, I found a connection between consent communication and sexual pleasure and quality of sexual experience. So the more explicit people communicate consent, the better the sexual experience. And then in another paper I did with some of my students, we theorized that consent could be linked to sexual satisfaction. So in this way, promoting consent could bridge sexual assault prevention with better quality sexual experiences as a more holistic approach to sort of sexuality education or sexuality discussions. And then also, at like the most basic level, if consent is sexy, that really implies that by default, non-consent is not sexy, right? So the notion that something is not sexy may, essentially, I think this notion of consent being sexy really tries to norm or present affirmative consent as normative, that this is something that people do and that it's a good thing to do and that it's sexy. So presenting affirmative consent as normative, I think, is a really important message as well. But in order for consent to be sexy, I think we need cultural norms that support people actively and affirmatively communicating consent. And unfortunately, I'd argue that that's not the current cultural climate that exists at many universities in the United States. The sort of consent is sexy depiction can't really exist in an environment where these sorts of messages are prevalent. In this kind of environment, I don't think an affirmative consent policy is effective. Affirmative consent assumes that more explicit consent communication will reduce sexual assault by reducing miscommunication or misunderstanding. But I'd argue that this environment sort of suggests that miscommunication is not really the root of the problem. And while it may be helpful to communicate more effectively, ignoring these dynamics may not result in any meaningful change in terms of sexual assault. Instead, I think that there's benefits to affirmative consent as a mechanism to reduce sexual assault, but I don't think it should be the only mechanism. I think, affirmative consent as an initiative really depends on cultural norms. And currently, I'd argue that current norms devalue being affirmative in terms of consent, particularly for women. So it's like building a great house, but on a broken foundation. I think we need to correct that foundation in order to have and maintain that great house. But I think there may be important cultural shifts in the ways we're talking about and conceptualizing consent and sexual violence. Over the last few years, there have been myriad allegations of sexual misconduct made by many in the public eye. And I think they've led to more critical discussions about consent and about consent and sexual violence. And then, of course, the Me Too movement has been instrumental in increasing public dialogue about sexual violence and consent in more nuanced ways. And I've also appreciated attempts made in television and movies to depict more nuance, to provide more nuanced depictions of sexual violence and consent. One example I came across recently was The Morning Show, which, if you've watched it, or I think that there could be critique to how they depicted things. But I think it does highlight that this issue is nuanced. It's not black and white. And I think that that was a really critical argument to put forward. So as you may recall, I began this talk discussing how variations in rates of sexual assault seem to be a function of inconsistencies in how sexual assault is measured, and that this kind of alleged controversy regarding prevalence rates of sexual assault is really a matter of values and how we're defining sexual violence, which really comes back to how we conceptualize consent. I'd argue there are complexities associated with consent, and trying to shy away from these complexities and these nuances is really a disservice to this topic. And in order for affirmative consent to be effective, I think we really need to dive into these nuances, particularly as it relates to gender and alcohol consumption, as these factors are still really relevant to college students and relevant on college campuses. So in addition to affirmative consent being a mechanism to address sexual violence, I also think we need to focus on initiatives that may shift socio-cultural norms about these topics, particularly how women and men are expected to behave sexually. And I think it's particularly important to highlight this information to those who might be serving on conduct boards, as they might not be aware of some of these nuances and complexities. And I also think we need more broader shifts away from prescribed gender roles that would allow more permissive sexuality, allowing men to refuse sex without those refusals being ignored because they seem irrelevant, and women to affirmatively consent to sex and not have those negative repercussions associated with women trying to affirmatively consent. And it would be helpful if this started long before students arrived on campus. For example, as part of comprehensive sexuality education during K through 12 education. Many states, like Connecticut, for example, don't require sex education. So starting with the basic requirement that school-age children be taught age-appropriate information about sexuality and sexual health is important. And it would also be helpful if evidence-based consent education was included as part of comprehensive sexuality education in public schools. But I also think we need to address gender norms at both the K through 12 level and continue these discussions in college. And I recommend, that current approaches to address sexual violence at the college level address nuances of consent, couch in discussions about gender norms, gender role socialization, and power equity, which include discussions of alcohol intoxication and alcohol consumption, as I argue that gender really influences multiple levels of a sociological model as it relates to consent, and also, and importantly, alcohol consumption and partying, as that's quite prevalent on college campuses. And I think these approaches can maintain the sex-positive theme that's promoted by affirmative consent. And I think that by highlighting that that affirmative consent can be part of having better sex can also help norm or make affirmative consent more normative. Ultimately, I think, as I began this talk saying, I think we need more affirmative approaches to sexuality in order to fully embrace affirmative approaches to consent. And I think both are achievable and would result in overall better sexual experiences. So with that, I think I'm getting close, maybe over my time, so I apologize for that, but I'll stop here. Again, I want to thank you all very much for your time and for attending. And again, thanks to Debbie, Melanie, Amy, Lynn, Josh, and Nana for inviting me to be a part of this lecture series and helping to coordinate all the logistics. And I look forward to your questions. If you end up having something that doesn't get answered or want copies of any of the papers, please feel free to email me. So thank you.
Thank you so much, Dr. Jozkowski. Everyone, please join me in giving a silent round of applause. That was such a comprehensive review of a very complex topic, and it was presented so clearly. Thank you so much.
Thanks.
Now we're going to begin the Q&A. So just as a review, if anyone has questions, please use the raise your hand function if you would like to ask your question aloud. And please also feel free to use the chat. I will look through any questions that are there. And it looks like we do have one question in the chat already. It says, Melissa, it's from Rajiv Bansal. Melissa Fivos, in her new book, Girlhood, talks about empty consent, not merely agreeing to unwanted sex, but the ways in which women are programmed to collaborate in their own diminishment. What are your thoughts?
So I will say off the bat, like, I'm not familiar with that book, but that concept is not unfamiliar. It sounds like a great book. I'll have to read it. I'm not unfamiliar with the concept of people agreeing to unwanted sex, particularly women. I think that there is research, and I had just one note on there, but from a study, but there's other studies, and even in some of my own work, women talk about, agreeing to unwanted sex as a form of relationship maintenance. On the one hand, I don't think that that's inherently problematic. We agree to things we don't want to do all the time. And I don't think that that has to be a bad thing. However, if you're seeing one group kind of doing it more than other groups or doing it more frequently, and I think that that is the case with women and girls engaging in behaviors that they don't want because they feel like they have to, that's another discussion. And so I don't know if that's what the author is getting at, but I think that that is part of our ideas about how we sexual double standards, how we portray sex differently for women and men. And I think that that is part of an issue. And I think that if the question's getting at, like, women contribute to their own demise in this way, like, I think it's because women realize these social repercussions exist and they exist within this system and they need to act within this system. And so they participate in that behavior. And that's, I think that that's unfortunate, and more empowering aspects of sexuality, particularly for girls and women, would be helpful. I hope that answers the question.
Thank you. We have another question from Christine Curley. Christine, feel free to unmute yourself.
Hi, Kristen. I've been waiting for this talk for a year. I have a gazillion questions. I am sure I'm going to be emailing you. I'm going to want all the papers. I research in sexual satisfaction and health. And my question to you is around, when you look to the Netherlands and Switzerland, they start this talk around positive sexuality as young as 4 or 5. And as you know, the United States has such, moral problems with that. What do you suggest would be a way to convince policymakers that this type of education at a young age regarding consent and regarding gender norms should start in elementary school?
I really don't know. So
I don't either.
So before I came back, I did my PhD in Indiana, then I was at University of Arkansas for 8 years as a faculty member, and just recently came back to IU. And when I was in Arkansas, that state as well has a lot of issues with sex education. And I testified a couple of times to the state legislature regarding sex education in schools and the need for any sort of sex education, comprehensive, that I would say that wasn't abstinence-based. And there can be good abstinence-based education, but what was happening in a lot of school districts in Arkansas was non-evidence-based, essentially abstinence-based sex education. So, I presented a lot of data, and I didn't have necessarily illusions going down there thinking, oh yeah, I'm going to change all their minds. The discussion was fantastic, that the questions they asked were fantastic. And then, nothing happened. And in talking to the representatives that had brought me there and I'd been in touch with, it was just like, this is a no-go because of the moral stronghold. I don't know what convinces people that this is good for everyone. This is good for people, for women, for girls, for boys, for men, for people outside of a gender binary, for just everyone. Data doesn't seem to do it, especially data on sexual violence. I think that is a more palatable topic than sexual pleasure, which I hate to say it that way. Like we want to address sexual violence. We don't want people to necessarily have good sex. That's part of the thought process among some people. Not me. I want people to not experience sexual violence and to have good sex. So that's a great question. I don't know that data is it. I don't know. I'm sorry. That's
No, I figured as much. It's just your breadth of research is so astounding, and I can hear your frustration. And I'm just at the beginning of my career, and I already feel it. But I appreciate your insights, and we'll just keep on keeping on.
Yeah, I guess finding champions, and I don't know. I don't know. I do. I wish I had a better answer.
Thanks for trying.
All right. Our next question is from Debbie Kornman.
Hi, I love your talk. I've read a lot of your literature, so I love the work that you do. So one of my concerns is, you put up pictures of these guys who've been prominent, who have gotten in trouble because of sexual assault, or most of them. I can see most college men who engage in non-consensual sex or have done that, saying, I'm not Bill Cosby. That's not me. They don't even think they're engaging in this behavior. So how do we help enlighten them? Because I think that's part of the problem. They're interpreting sexual cues, or cues, not just sexual cues, context very differently. And that's problematic. And they're like, that's not me. I'm not someone who engages in this kind of behavior.
I think that's spot on. I think that's something that, so before I went back to school to get my PhD, I was doing sexual violence prevention education for a couple of years. And one of the things that I observed from that work was that, people othering themselves from either perpetrators or victims for various reasons. And seeing perpetrating behaviors as something that's really egregious and really violent. And I don't do that, so I'm not a perpetrator. That's, I think, comforting for people. I think it's certainly much more comforting to say, wow, maybe I do engage in some of this, or maybe my son, my brother, my boyfriend, my partner, my friend engages in this. And I think that's the really difficult aspect. And that's where what's kind of what I meant by like having more nuanced discussions, because I think that when we, conceptualize sexual assault, even though we might say, well, we know it's mostly by someone the victim knows, the victim and perpetrator, know each other. We think about these things. We don't actually break down what that means, that there's a relationship, whether it's a romantic relationship, a friendship, they just met each other for a couple of days. There is some sort of like relationship there, and that suggests trust. And then that sexual violence doesn't always look like something that's violent. And that's where I think having these examples of having more nuance, and the morning show is a television show I just happened to be watching earlier this year. Was just looking for something to watch and put this on, and thought it was going to be something that a comedy, actually, given the actors who were involved. And it's not. And they talk about sexual violence. And there's one remarkable scene that sticks out to me where one of the characters who has just been accused and sort of lost his, he was a host for a morning show. He got fired from his television show. He's talking to another guy who's more like a Bill Cosby-esque character. His character engages more Bill Cosby-esque behavior. And he leans over and he says, I'm not you. I'm not a predator. And like premise of this season of the show is pointing out how he is a different type of predator, still a predator, but a different type of predator. And I think those sorts of nuanced conversations are really important. And to start that early on, that, that sexual violence doesn't always look a particular way, and what we mean by consent and communication and all these different gender dynamics and factors, really important to highlight. And that's where I've been a little bit critical of affirmative consent, because I think that it's a good starting point. But just saying, just get consent, just get yes, is not sufficient when you have all of this complexity around it. And I think that really gets at the heart of some of that. And so that's why we need to introduce those complexities into our discussions and have those discussions. Because, you can have that very easily, setting aside what other people do and say that doesn't apply to me. hope that answered the question a little bit. I think
a lot. Do you think, I don't know, have you done any interventions where you're actually bringing women, I can't remember, men and women together to have these discussions so that they can see how they interpret cues and context differently? I think that would be fascinating.
Yeah, and the program that I used to run, this is like going back 10 years. So this is like going back early 2000s, before like affirmative consent was something that was more readily knowledgeable, people knew about it. I did do, mixed gendered programming.
That's what I thought.
Yeah, and I think removing the element of gender is, which I know some programming, to be more gender inclusive, I think we've removed the element of gender, but I think that's important to include. And I think the way in which sexual violence happens in same gendered relationships looks different. And so I think that's a separate issue to address, but I think that gender is really important to address in these conversations. And I mean, I've done simple things in some of my classes or some of the interventions I used to run, where I'd ask people questions about various questions and, how they exist in the world. Like, one of the things I used to say is, how many people in the room who identify as women, how many of you have ever at least stepped on an elevator with someone with other men being on the elevator, and at least had a second thought about getting on the elevator, whether you got on it or not, something crossed your mind, or, you're walking home at night and someone was like behind you. You may have continued to do that behavior, but something flashed in your mind, and most women raise their hand. And you ask the same question to men, and they don't. And part of that exercise, I was trying to highlight, not that sexual violence happens in elevators or in parking lots. It's not the most common experience, and I try to emphasize that, but rather that the way in which we interact in the world is different based on gender, and helping people recognize that can help maybe break down some of these nuances that I think are really important to address.
Thank you.
Yeah.
Thank you. Any other questions? We have, there's a comment in the chat from Carrie Adamson. Says, I use a similar example in classes of how many of you learned how to carry your keys for self-defense, men versus women?
Yeah, I think that those sorts of examples are really important, because I don't know that men, men may not realize the different worlds that exist, and that you're not taught to carry pepper spray or carry your keys or do some of these things. Yeah, and men are usually quite surprised when they see the number of women's hands go up, and when I do those exercises, and we talk about those. I had the privilege of teaching both at Arkansas, and hopefully I'll do it here at Indiana, a class on sexual violence, and just having those discussions, having an entire semester to talk about these critical issues in a very nuanced way, really helped men uncover a lot of things, and women too, because people disregarding gender engage in victim blaming. It's not something that just one gender or one group of people engage in. People, unfortunately, our culture sets up engagement in victim blaming, and that is common.
Thank you. I believe those are all the questions that we have. Thank you again for this great discussion. And thank you everyone for attending our final lecture of the semester.
Yeah, again, thank you so much for everyone and for the questions. And again, please feel free to email me if you have other questions or would like any papers or any more information. So thank you.
Awesome. Thank you.